Masters Entertainment.
Steamy chiller that kind them like bang killer one steamy dance steamy. DJ Whisper steamy.
hope so too.
One, two, one, two, one, two. Is it clear? Is it clear? Check one, two. Check one, 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 two. One, two, one, two, one, two, one, two. One, two, three, 4, 5. 1, 2, 1, 2.
sit down, those who can sit, please. A little bit early, sometimes late, so. Do I just start? Is there a countdown? What is it? Do I just start or what is it? Huh? Oh. Good afternoon, fellow Namibians. This is the most somber time in our nation's history. The past several weeks have been exceptionally difficult as we continue our battle against COVID-19 pandemic. The loss of lives has been unprecedented. Indeed, Namibia weeps for her dearly departed children. We have lost grandmothers, grandfathers, mothers, fathers, brothers, sisters, sons, and daughters. We have lost husbands and wives. We have lost friends and colleagues. We have lost leaders, teachers, mentors. We have lost our frontline workers. We have lost stalwarts of our liberation struggle. We have lost bedrocks of our communities and nation. We have witnessed pillars of strength whittling away in our presence. Today, the pain of loss continues across the country. And this morning, I received the heartbreaking news that Honorable Werner Pereira, Deputy Minister of Higher Education and Technology and Innovation, lost her life in the fight against COVID-19. I'm aware that many of you are carrying the heavy burden of loss and bereavement. You are not alone. The whole nation has been affected by the specter of death, and we stand together, shoulder to shoulder, as we confront the most deadly challenge this country has faced. I therefore offer my sincere condolences to the families and friends of all our Namibian brothers and sisters who have succumbed to COVID-19 and related illnesses. May their souls rest in eternal peace. Fellow Namibians, we have been confronting the deadly third wave of the pandemic in recent weeks. There is some degree of relief, because over the last 14-day observance period, we have witnessed a welcome respite. There has been a noticeable reduction in the positivity rate from the high figure of more than 40% at the beginning of July to an average of 28% in the last 2 weeks. The numbers of new infections have reduced, concomitant of lower number of hospitalization due to COVID-19. More isolation and ICU beds are becoming available in the public and private sector health facilities. These are signs of progress in suppressing the transmission across the country. Cumulative infections in the country now stands at 117,896 since the index case in March 2020. Encouragingly, the national recovery rate stands at 80%, while the fatality rate stands at 2.5%. However, the fact that we have recorded 1,414 deaths within 28 days is troubling. It is therefore critical that we do everything within our power to reduce the alarming rate of death that we are experiencing. Deaths are destroying our families, our communities, and our nation at large. There has been considerable reduction in new infections across all regions. However, there has been noticeable rise in deaths in Kavango West, Oshana, Omusati, and Hardap regions. Omaheke has the highest case fatality rate of 6.5%, almost 3 times the national average of 2.5%. In this regard, we must maintain absolute vigilance as a means to reduce new infections, get more people vaccinated in order to prevent severe COVID-19 illness and death. That is the nature of the challenge we are facing. We cannot tire, we cannot relent. Although the incidence curve has plateaued and started on a downward slope over the last 14 days, this is no cause for celebration. We are not out of the woods yet. This disease has caused us too much in terms of precious lives of our loved ones lost, our businesses and sources of livelihood severely impacted. The nature of this disease has forced us to adopt new ways of interaction. We must continue to adhere to the interventions that we have put in place. We cannot throw caution to the wind or abandon the health and safety protocols which have been designed for our protection. That will be disastrous for our country. Let us not grow weary of doing what is right. Let us not grow weary of doing what is right. That is social and physical distancing, the wearing of the mask, safe hand hygiene, and vaccination are the best and proven methods to defeat COVID-19. We must therefore continue to marshal our resolve and resources towards total suppression of this virus in order to move towards a semblance of normalcy. We witnessed a few weeks ago in some parts of Europe soccer and tennis stadia filled to capacity, with persons not even wearing face masks. That is confirmation that returning to a measure of normalcy is within our reach if we succeed with our vaccination campaign. But in order for us to succeed, we must fully deploy all the measures at our disposal to bring an end to this devastation. I appreciate the engagement of the public via social media as we seek solutions to overcome this pandemic. Many of you have sent me helpful but thoughtful or thought-provoking suggestions this morning or yesterday. Today alone, I received more than 60 messages from Namibians sharing their ideas with me on how to deal with COVID-19. We will definitely try to accommodate some of your ideas as far as feasible. But those who are asking for me to give them alcohol must forget. Fellow Namibians, we should continue adhering to public health regulations by minimizing personal movement and travel, and very importantly, getting vaccinated. Our target is to vaccinate at least 1.5 million of eligible Namibians, or 60% of the population, by 31st March 2022, to attain herd immunity. While respecting the health choices of the individual, we find ourselves in a unique and rather complex crisis in which the decisions of the individual has a bearing on the collective. The national vaccination rate for persons fully vaccinated has increased marginally from 1.3% 2 weeks ago to the 1.8% vaccine population coverage. Those who have received the first dose have increased from 5% to 6.1% over the same period. This is attributable to a rising rate of daily vaccinations, which currently stands on average at 3,082 doses administered daily. The access to vaccines has been significantly bolstered by the intensification of the vaccination drive across all parts of the country, including through the innovative vaccine drive-through facilities in Windhoek, a private sector initiative led by Gondwana Collection. In addition to all the corporate sponsors that I thanked in previous statements, I would further like to recognize and appreciate the contributions made towards our collective fight against COVID-19 by the following organizations: Pick and Pay, Namibia Breweries, Sanlam, Leseko, Namib Foam, Scania Namibia, Sandem Namibia, Momentum Metro Namibia, Swakop Uranium, De Beers Group, Reptile Mineral Resources and Exploration, Deep Yellow Limited, PPS Insurance Namibia, and CBM Tech. If I forgot some, we'll always keep on adding. We thank you. Yesterday, the Prime Minister commissioned a field hospital at Kadudura Hospital, a 77-bed facility funded by the private sector. The Old Namibia Pathology Institute building adjacent to Kadudura Hospital has been renovated, adding 46 beds to the isolation facilities. This adds an additional 123 beds to provide care for those who will need it most. More isolation facilities are being built in regions where there is needs still. Vaccination remains an important weapon in our arsenal. Repeat, vaccination remains an important weapon in our arsenal. I therefore reiterate my call upon all Namibians who are eligible to get vaccinated and help to save lives. Let us not allow vaccine skepticism to curtail our efforts of reducing new infections and thus opening up and returning our country to normalcy. I'm aware of what has been called an infodemic of misinformation in the form of campaigns to deliberately propagate false information about COVID-19 vaccines. Let us not be swayed by those who aim to capitalize on unfounded fears and dissuade our people from getting vaccinated. We must act wisely, act responsibly and selflessly, and act now. We owe it to ourselves, our loved ones, our communities, and the nation at large to get vaccinated. I also caution those who have been vaccinated to continue to take all necessary precautions and not to adopt a carefree attitude. You still have a responsibility to protect the broader community. Our health experts advise us to behave in a manner that can protect our families and our communities. In this context, wearing a mask, practicing physical distance, and hand hygiene must continue. Namibia maintains a high level of testing coverage for COVID-19. We have one of the highest testing levels on the continent, with a testing average of 239 people tested per 1,000 persons. We are third on the continent after South Africa and Gabon. Testing is important because it enables us to find new infections, clusters, and thus to target interventions accordingly. The measures adopted at the start of July were strict but necessary. The trends we are reading from the data indicate that the measures, coupled with the public compliance to the regulations, have broken the momentum of the pandemic and suppressed further transmission. Fellow Namibians, the current public health regulations will expire at midnight tomorrow, Saturday, 31st July 2021. The following regulations will come into force for a period of 14 days from Sunday, 1st of August 2021 until midnight Saturday, 14th of August 2021. 1. Travel restrictions. Travel restrictions are hereby lifted, permitting the resumption of travel between regions without a permit countrywide. The public is, however, urged to strengthen public health measures at personal and community levels. 2. Public gatherings, as defined in the regulations, have been adjusted to 50 persons per event. Any public gathering should not last for more than 2 hours. 3. Curfew will remain in force, however, from 22, that is from 10 o'clock to 4 a.m. daily. 4. Education. All schools are to resume face-to-face teaching and learning on 4th of August 2021 with strengthened infection prevention and control measures in place. B. grades 7, 9, 10, 11, and 12 to resume face-to-face teaching and learning on full-time basis daily. See, the early childhood development centers and lower primary grades may resume but are required to operate in cohorts or shifts. The management of educational institutions must ensure the safety of school environment for employees, learners, and students. 5. Restrictions related to liquor. The sale of liquor remains restricted on takeaway basis between 9 a.m. to 18 hours, from 9 a.m. to 6, Monday to Friday. There was a big debate. We must end from, say, Monday to Thursday. But we're told we have to do a little bit something for businesses. So Monday to Friday, except for those hospitality establishments that have resident guests. 6, business operations. All food establishments, namely restaurants, cabana traders, and food vendors, may resume on-site meals subject to compliance, strict compliance with health and safety protocols. Businesses deemed to be high risk, such as gyms and sports clubs, remain closed. C. Spas, salons, and beauty parlors remain open, subject to adherence to mandatory face masks and maintaining physical distance of no less than 1.5 meters. D. Indoor or outdoor swimming pools and playgrounds may resume operations subject to adherence to health and safety protocols. And motor vehicle passenger restrictions remain in force, loading public transport vehicles at half capacity, including for tour operators and shuttle services. 7, burials. Burials due to COVID-19 must take place within a period of 10 days. All the current burial-related regulations remain in force. 8, test results upon entry into the country. The validity of the PCR test results will be reduced from 7 days to 72 hours for all travelers to safeguard the country. Namibians arriving with a de-isolation certificate within a period of 3 months will be allowed entry and not be subject to quarantine. Fellow Namibians, achieving a victory against COVID-19 is within our reach. However, victory can only come about through a disciplined, concerted, and collective effort involving the entire spectrum of the citizenry of the Republic of Namibia. We can be our greatest ally or our greatest enemy. It has been said that victory is always possible for the person who refuses to stop fighting. Let us not stop taking the fight to the enemy. Now is not the time to waver. Now is not the time to falter. But now is the time to strengthen our resolve and keep fighting in order to defeat COVID-19 and commence or rebuilding our economy. With that, I stop and I call on the following ministers, if they are available, starting with health, of course, justice, education, and Attorney General, to elaborate or provide further clarification on the technical aspects. God bless the Republic of Namibia. Thank you. Minister.
Thank you very much. Thank you very much, Your Excellency, the President of the Republic of Namibia, Right Honorable Prime Minister, Deputy Prime Minister, ministers, officials, members of the media, ladies and gentlemen. I start by thanking His Excellency, Dr. Hage G. Geingob, for his strong leadership and stewardship of the country during these difficult times. Following a period of sharp increase of COVID-19 cases, hospitalizations, and deaths, Namibia have started to observe a decline in the number of new infections. During the period 16 to the 29th of July 2021, a total of 8,064 new COVID-19 cases were reported, compared to 19,157 cases reported between the 30th of June and the 15th of July 2021. However, the number of COVID-19 deaths continue to be a matter of great concern. High death rates, albeit slightly reduced, they are being reported particularly among older age groups and persons with morbid conditions. During the period 16th to the 29th of July 2021, a total number of 628 Namibian citizens have succumbed to COVID-19. The decline in the number of reported cases correlates with the public health measures introduced and implemented to combat the spread and impact of COVID-19 pandemic. While this is a welcome development, the elevated positivity ratio, now averaging 30%, and the high number of reported fatalities are indications that the country is still susceptible to sustained widespread community transmission, which requires and demands strict observance of the preventive public health measures by all of us. In an effort to expand testing and reduce the turnaround time for laboratory results, the Ministry of Health and Social Services, with the support from partners, roll out antigen rapid diagnostic testing following a determined algorithm. A total of 1,872 rapid tests have been conducted countrywide by the 27th of July 2021. Furthermore, Namibia continues to closely monitor the emergence of COVID-19 variants of concern through routine surveillance and genome sequencing conducted by the University of Namibia and the National Institute of Communicable Diseases in South Africa, working through the Namibia Institute of Pathology. The capacity for genome sequencing in Namibia is further enhanced with the support received from Africa Center of Disease Control and Prevention. Namibia has also received contribution and support from several countries and organizations to strengthen our COVID-19 response and preparedness, especially in dealing with the third wave. This includes, amongst others, the IT equipment to be deployed at 176 vaccination sites around the country in order to computerize the capturing of data. This will ease the process of reporting and record keeping. We have also received logistics and human resource support for the vaccination program. Several EU member countries such as Germany, Finland, Belgium, and Norway have provided laboratory consumables, personal protective equipment, and hospital beds, to mention just a few. The United Kingdom has supported us with capacity building on COVID-19 case management and emergency care via online training. Africa CDC has donated medical equipment, pharmaceuticals, and laboratory consumables. Significant contribution by the local business community and individual has also been significant. The donation included oxygen tank, oxygen concentrators, hospital beds, medical equipment, the establishment of additional COVID-19 isolation facilities, and psychosocial support for frontline workers, just to mention but a few. We commend and thank our First Lady, Madam Monica Genkos, for initiating activities that support the creation of awareness on the importance of combating false information around vaccination, as well as the importance of supporting our frontline workers. This support is wholeheartedly welcome and truly appreciated. The Africa CDC delegation that visited Namibia in the past 2 weeks has commended Namibia for the innovative approach to repurpose existing health infrastructure as part of the COVID-19 response. They have indicated that they will recommend our model for adoption in other countries in their efforts to combat COVID-19. The existing COVID-19 public health measures have been amended as has been announced by His Excellency, and this is part of our ongoing effort to combat the pandemic, to protect our people, and to enable Namibians engage in activities that support livelihoods. As we are all aware, our economy has been severely battered by the impact of this pandemic, and a balance has to be struck in terms of saving lives and preserving the livelihoods of our people. As stated by His Excellency, I will provide further context on some of the amendments to the current public health COVID-19 general regulations. On education, the management of educational institutions must ensure that school environment is safe for employees, learners, and students. The following measures should be implemented. Encourage vaccination of teachers, other staff members, and eligible learners. Screen for symptoms using the Ministry of Health and Social Services COVID-19 screening tools and testing of symptomatic learners and school staff. Ensure distancing in dining halls. Ensure that no contact sports are taking place. A strictly supervision of COVID-19 public health measures. Rapid response team to be on alert to respond to reported cases in schools. And finally, strengthen health education and awareness in schools as a continuous process. Life skills teachers should be empowered to be able to provide psychosocial support to the affected learners and staff members. On higher education, online teaching, learning and assessment for programs not requiring practical exposure and having large class size must continue. Blended mode of teaching, learning and assessment for laboratory-based training programs, including engineering, clinical training, and TVET programs, as well as programs requiring professional registrations, must continue. On COVID-19 laboratory testing, only the approved and validated antigen rapid diagnostic test kits will be authorized for use in Namibia. Use of these kits must be linked to an approved local laboratory, clinic, hospital, and casualty setting only. No other antigen rapid diagnostic test kits will be allowed to be used in the country without the authority from the Namibia Medicine Regulatory Authority. Your Excellency, ladies and gentlemen, I shall now update and elaborate on very key issues. First one on hospital bed occupancy. The hospital bed occupancy rate has significantly improved in most of the regions, both for general isolation and for the ICU. During the last 2 weeks, the bed occupancy rate reduced by 18% in general isolation, from 55% to 45%, while for the intensive care units, a reduction of 52% was observed, from 111% to 53% by yesterday, the 29th of July, 2021. As has been stated by His Excellency, a 70-bed isolation field hospital attached to Katutura Intermediate Hospital was completed and inaugurated and handed over to government by the Namibian Chamber of Commerce and Industry yesterday. This field hospital will be managed as a ward of Katutura State Hospital. The former building of the NIP was repurposed and converted into a 46-bed ward for COVID-19 patients. This is in addition to the 74-bed old TB wards, the conversion of 5A into a 64-bed wards, and the repurposing of 5A into a 34-bed facility, all at Katutura Intermediate Hospital. Work has started for the construction of a 98-bed ward also at Katutura State Hospital. A 12-bed prefabricated isolation hospital for Okahau was handed over to the contractor yesterday. Plan for the construction of isolation facility at Andara, Chivarongo, Okahanja, and Karasberg are at an advanced stage. On mortuaries, mortuary space has been increased at Windhoek Central Hospital, Mariental, Walvis Bay, Okahanja, Chivarongo, Utapio, Nanjokwe, Kobabis, and Sumip. The space of fixed mortuaries was complemented with mobile refrigerated containers of various sizes and capacities. On oxygen, in light of the increased hospitalization during the third wave, severe pressure was experienced regarding the access to and availability of sufficient and reliable oxygen to support patients who need it. This was one of the challenges during the peak of the pandemic. This experience has taught us that we need to create local capacity for oxygen production in the country. In the meantime, oxygen bulk tanks have been installed at some of the health facilities, and oxygen cylinders were procured and are being filled with imported oxygen on a regular basis in collaboration with the private sector and other partners. The bulk oxygen tanks are in use at the following facilities: Katutura Respiratory Units, where there is a 20-ton tank; Walvis Bay Hospital, where there is a 6-ton tank; Sumeb Hospital, 6-ton tank; Oshakati, 20-ton tank installation, which is currently in progress; and Katutura Nurse Home, there will be a 13-ton installation to commence, and the Swakopmund State Hospital will have a 20-ton tank, which is currently being refurbished. The installation of other oxygen supply infrastructure are ongoing at other hospitals. This included the supply of oxygen concentrators to be deployed at health facilities around the country. Allow me to spend a minute or two on the vaccination campaign. The vaccination program has made great progress despite the setback of delayed delivery of doses from some suppliers. In addition, an additional 48 new vaccination sites have been established so that we can increase the vaccination footprint around the country. These include all 14 police regional headquarters and several mobile teams and private facilities. As of yesterday, the 29th of July 2021, a total of 159,881% of the eligible population has received the first dose, while 48,069 persons of the eligible populations are fully vaccinated. A public-private vaccination innovation was introduced in the Commerce region in the form of a drive-through vaccination site at the Windhoek Showground. The private sector, led by Gondwana and OSMED in partnership with the Ministry of Health and Social Services, had set up the first ever drive-through vaccination site at the Windhoek Showground. This innovative idea attracted over 1,000 individuals for vaccination within the first 2 days. The ministry provided complimentary staff, forms, and vaccines for this operation. A consignment of 250,000 doses of Sinopharm that the government procured from Sinopharm China was delivered on the 16th of July 2021 and has since been distributed to all 14 regions by the 18th of July 2021. We are grateful to the private sector for its contribution through the Vaccine Hope Coalition in delivering the vaccine to Namibia. During the last briefing, I announced 165,200 doses of the Johnson & Johnson vaccine as a donation from the government of the United States of America. I'm happy to inform that the number of doses has since been increased to 302,000 doses. These doses will be delivered to Namibia through the COVAX facility. We will inform the nation on the delivery date in due course when such information becomes available. The State of Netherlands has pledged and confirmed that they will support Namibia with 75,000 doses of AstraZeneca vaccines. The ministry has concluded and submitted all required documents and are expecting information on the delivery date. The consignment will greatly help Namibia vaccinate those awaiting their outstanding second dose of AstraZeneca. We are working day and night to ensure that all individuals whose second dose of vaccination is outstanding will be vaccinated as soon as the doses becomes available. We received communication yesterday that 9,714 doses of the 333,333 doses of Johnson & Johnson vaccine, which was procured through the Africa Vaccine Acquisition Task Team, will be delivered during the week of the 23rd of August 2021. All vaccination sites around the country currently have access to Sinopharm vaccines. We expected to see the vaccines landscape diversified with increased access to other types of vaccines. This week, the ministry conducted training on the administration and other aspects of Pfizer and Johnson & Johnson vaccines. The training of trainers attended by over 140 healthcare workers from around the country was conducted in anticipation of the arrival of these vaccines in the country soon. The attending traders of trainers will cascade the training to vaccinators at district and facility levels to increase the staff complement of staff trained to handle and administer the above two vaccines. On Monday and Tuesday this week, I visited Oshikoto, Oshana, and Omsati regions to observe the COVID-19 response situation, especially the vaccination activities in those regions. I visited vaccination sites at Otapi, Sandi, Okahao, Oshakati, and Nanjokwe. I must express my grave concern about the extremely low vaccines uptake, especially in the Omsati region. Of the various vaccine sites that I visited, I found no or only a few persons who have come for vaccinations. While vaccination teams were deployed at the sites, members of the public have not showed up. According to the vaccination officials, the daily average of vaccines at their respective site per day is only in two-digit figures. This is a cause for serious concern, and I wish to use this platform to call on all eligible persons to go for vaccination. It was even reported that some health workers have in fact been discouraging members of the public to get vaccinated. Health workers are strongly warned not to engage in such activities. Those who make themselves guilty of such violation will be dealt with in terms of the applicable laws and regulations. In conclusion, I would like to thank the public for ongoing cooperation that has enabled our country to suppress further infections, reduce hospitalization and deaths in the last 2 weeks. We have taken a calculated risk with the considerations of the new measures. While some are being relaxed to achieve a balance between saving lives and ensuring livelihoods, we must not let our guards down. We must exercise self-policing to ensure the situation remains under control. Each one of us have a responsibility to protect our families, our communities, and our nation. I thank you.
Well, thank you very much. Are the legal people trying to clarify things? Oh, Prime Minister or Deputy Prime Minister? Normally we allow them to. Yes, legal. We'll have answering questions.
Good afternoon, Your Excellency, and thank you very much, and thank you for the presence of the media. Your Excellency, I just want to clarify a few things in respect of the measures and the adjustments that have been made in respect of the measures. The first thing that I want to clarify, Your Excellency, is that whatever that has not been adjusted remains in place. So the first adjustment, Your Excellency, that I want to clarify is the lifting of the travel restrictions. What that means is that people can only start traveling without a permit from Sunday. So this does not apply from today, because I'm already starting to get indications, can we start traveling today or tomorrow without a traveling permit? Between today and tomorrow, if you want to travel, you will require a travel permit. And the travel permit is only given on the basis that it's an emergency, that it's a funeral of a sibling or a parent, and also if you have particularly a medical emergency. Second issue that I want to clarify, Your Excellency, is that we have indicated that gyms and sports clubs remain closed. That also applies for nightclubs and bedding houses. So anything else that His Excellency did not list as having opened, such as a swimming pool, recreational parks and so forth, they remain closed and or prohibited from opening. The other one, Your Excellency, that I want to clarify is that even though we have now opened up eating places, it is still required that those that participate in taking on-site meals at a restaurant, for kapana, you must still maintain a healthy distance of at least 1.5 meters. This is extremely important. So you cannot kind of push people or create a crowded space simply because we have opened up this particular arrangement. We have done so because we realize that we don't want to, we do want to continue and preserve the livelihood of our people. The last, maybe two things that I want to say is that alcohol remains at a takeaway basis, even though it will be sold from Monday to Friday, it remains on a takeaway basis, except for people who live in a hotel, who live in a guest house. They have access even over weekends because they live there. But so you cannot go to a hotel or to, for example, access alcohol on a Saturday if you are not a guest at that particular establishment. Your Excellency, I want to just make two further comments. The first one is I want to thank particularly radio stations, both public and private radio stations that have taken up our call to increase their coverage of COVID-19 messages. We have seen a tremendous increase in this regard. But what we also have is an information cluster that is responsible for disseminating information, and that will also, there will be an increased visibility of the activities around information that pertains to COVID, but also information that pertains to vaccinations that will be made available to members of the public. I want to pause here, Your Excellency, and just indicate that even though we have now increased the curfew times by 1 hour so that it starts at 22 hours to 04 hours, we still require people to, if they are found, we encourage Namibians not to be found wandering and or finding themselves outside those periods. But if you are found, the only reason that is acceptable is if it's an emergency, if you need law enforcement assistance. For example, if you're on your way to a police station, that would be acceptable. Anything else is really regarded as falling outside the requirements of the regulations. Thank you very much. I will take questions if the media is ready then, Your Excellency.
Legal, any further? Attorney General?
Thank you very much, Your Excellency, Honorable Prime Minister, Deputy Prime Minister, colleagues. Good afternoon. Your Excellency, I just want to emphasize a few things following the announcement of the relaxation of certain restrictions on travel, gathering, curfew, business operations, and schools. As we all know that this relaxation shall come into force on the 1st of August, what this means is really, it requires that we all start to take responsibility, both individually and collectively, since the relaxation doesn't mean that COVID shall go away, as we have been told that we are still in the wood. And it still requires that we adhere to the necessary COVID protocols and other measures that will help us to still fight and combat the pandemic. So therefore, we are being encouraged to continue to be vigilant in complying with the health regulations and also in complying with other measures that are in place to ensure that we don't expose ourselves to the risk, and also that we don't expose others to the risk. We have heard from Dr. Shangula that the vaccination uptake in some areas is still low, and there has been efforts to try to encourage people to go for vaccination. But we have also noted that there are still some members of our society who are continuing to distribute false and wrong information about the prevention of the pandemic. We just want to highlight and point out that this is an offense to do so. And I want to discourage members of the public and individuals who are making themselves liable for this to desist from doing so, to prevent any publication of such false information, so that we can all encourage people to go get vaccinated in order to deal with this pandemic. So I'm saying this because it appears that as much as we appreciate the power of social media, we still find people who are misusing it for wrong reasons, and therefore I want to encourage people to go for vaccination, and also to ignore these wrong messages that are propping up, discouraging people to go for vaccination. And finally, just to say that should you then make yourself guilty of circulating false information, you shall then be liable, for either a fine up to $100,000 Namibian or imprisonment up to 10 years in prison. With those few words, Your Excellency, I will end here. Thank you.
Others will, education, okay.
Your Excellency, good afternoon. I would like this opportunity to amplify and add some flesh on your points, Your Excellency, and Dr. Shangula regarding the reopening of schools. In point number 1, as it was said, our schools have been on winter holiday, which resulted from the amendment of the calendar, school calendar, whereby we had a long winter holiday, and the other summer holidays, like the August holiday, will be very short, maybe only some days. So the schools are reopening on the 4th of August. But the mode of reopening will depend on the different phases, as it was said from His Excellency's speech. The higher grades, including the other grades which are considered like exit points, like grade 7, 9, 10, 11, and 12, those ones will attend full-time. Full-time meaning when we usually reopen schools during the whole period of COVID-19, we have been applying cohorts. Some learners go, some stay, some go some days only, some stays and go the other day. But for this time, we are saying all these grades, they attend full-time face-to-face on a daily basis. When it comes to pre-grades to grade 6, these ones, they also reopen, but here we again request our schools to apply contextually relevant measures to prevent COVID, depending on the size of the school, the size of the classrooms in the schools, for them to be able to apply either cohort or alternating days as we used to do. To this effect, we will still sit and issue clear directives to schools. The other thing that we considered is the issue of smaller schools when we reopen. As much as we are saying lower grades pre to 6, they can apply cohorts, we are saying if a school is too small, like we have got really some small schools where we find 50 learners only per school, or maybe smaller than that, that one we do not have a reason not to say all the children can go to school anytime, as long as the school is able to really adhere to COVID-19 protocols and ensure that identification and prevention and control measures are applied. So the other thing why we really feel that if a school is so small that learners can go to school on a daily basis is the fact that many of our schools also depend on school feeding at our schools, and which they have really been missing on when we close schools. So it's up to the schools and the management of the schools and the regional directorates to take care of that situation. The other point that I want to emphasize is, as it was mentioned by Dr. Shangula, is the issue of really schools to ensure that the prevention and control measures are taken serious. What we are doing now, having noticed that we have lost many of our teachers, we know that by the time we go to schools, definitely there will be a kind of a traumatic situation for learners to go back and find that either their principal is not at school or their teachers at the school. That's why the issue of psychosocial support is really emphasized. And what we are busy doing already is we are busy training teachers through the regional school counselors and life skills teachers to ensure that this issue of psychosocial support should not be taken for granted. Children are children, and they may go to school and really get shocked because of these stories of their teachers no more. So we are taking care of that one. The other thing that we are also doing is really we have started even before the school closed already with the vaccination campaign, working together with our teachers union, NANDU. They are out on the field, and we are busy doing vaccination campaign to ensure that our teachers and all our learners 18 and above are vaccinated. When it comes to infection prevention and control measures at schools, we really urge the schools to continue. Although social distancing has always been a problem in the schools, but we will see how we should adhere to that one. And in fact, while talking about that one, I would assure the nation that with the 800 million that was allocated to the Ministry of Education to take care of admission facilities, waters at schools, additional hostel blocks, significant strides has been made in this direction, such that out of 2,051 host ablution facilities that were supposed to be renovated, 243 have been done. And out of 305 ablution facilities new that were supposed to be constructed, we have already finished constructing 235. And when it comes to hostel renovation, we identified 87 hostels to be renovated, and 84 hostels out of those have already been renovated, and while 3 are ongoing. And also, we had some new hostel blocks being constructed at some schools in order for us to really ensure social distancing in hostels, whereby 42 hostels have been identified and 34 of those are finalized. So, in conclusion, Your Excellency, I would really like to emphasize the issue of community transmission that have been confirmed all around. Thus, we also have observed that there is no significant drop in cases when the schools close and when they are opening, which was only 0.2 for learners drop. For teachers was 0.2, and for learners it was only 1.6 drop, meaning the infections takes place wherever the learners are, especially where the main important thing is to note that the cases that we identify at school, the research that has been done by the Ministry of Health discovered that all the cases at the schools where the study was done, the transmission takes place in the communities. With this, I want to urge the community members, all of us, to join hands. It's one thing for us to call for schools to reopen, but it's another thing for us to keep schools to join hands and ensure that our teachers and learners are really secured. I mean, their health is secured at schools. So it's really a call to the community for all of us to join hands and ensure that we are vaccinated and our teachers are vaccinated our children 18 and above, parents ensure that the children are vaccinated, and this way only we'll be able to continue schooling without fears. I thank you, Your Excellency.
Now we'll open a few questions to be asked, and we can start to drive. Or today is not until 12 midnight, you have to wait. Floor is open to ask questions on what we have discussed. Welcome. This is the 31st meeting we have. And you are coming here for the first time, I hope. Welcome.
Did you miss me? Good afternoon, everyone. Your Excellency, I just want to start with you. 2 or 3 questions. Matthias Ofiko from Namibian Sun newspaper. We've seen, especially during the last lockdown that's going to lapse now, on Saturday evening, that most of the violations of the curfew seems to be happening at state events, like state funerals, where senior government officials are also present. Some of them, you were there also. But we've not seen you calling out these actions to say, colleagues, we are too much here, I think we need to disperse. What's the way forward then? Do you think this has perhaps any impact on the public's decision not to respect some of these regulations that are put in place, because they see their leaders breaking these regulations, so why should they adhere? Secondly, I'd like to know also the issue of education around the vaccines. It seems there's our way or the highway approach when it comes to dealing with people who have concerns regarding the vaccines or who have criticism. And we see it during, especially during elections, there's a high campaign and a high drive to get people to vote, but we don't see that here during COVID. Is it perhaps a thing of limited resources, or what's going on? Because we also don't know if there's a budget for vaccine education. Maybe you can just touch on that also. Your Excellency, there's also talks that some sections of the public are planning to undertake a demonstration against the decision to appoint the ACC director, Mr. Paulus Noah.
No diversion here.
No, it's not
That's
diversion.
why you came.
No, it's not a diversion. I'm asking because if there's a demonstration...
Could I tell you, we are discussing your article. Go and ask me somewhere else. We are discussing here the problem we have been discussing 31 times.
Yes.
And you came here to divert us?
Are you not afraid that a mass demonstration could then take us back, since we are already making strides with the virus?
Please, we presented a case. Can you ask questions on that?
Yes.
Okay.
Right Honorable Prime Minister, I'll move over to you. The accountability report. The public wants, and especially the business community wants to know, what are the immediate economic recovery plans that are being worked on by government? And in terms of the accountability report, it's almost over a year now. Government preaches transparency, but there's still no sign as to when that will come out. People are concerned as to how these funds are being handled, the 8.1 billion. That's why you see some economists and analysts saying that it seems the 8.1 billion was not there to start with. I also want to know from you some relief measures, such as the Social Security relief measures, the DBN and so on. Businesses are already struggling. Their financials are in red. Their bank statements, the deductions are bouncing. But some of the requirements to access this relief requires businesses to provide these statements. Some businesses don't even have money right now to go to accountants to do their books. So what are you doing to ensure that businesses can indeed access finance during this difficult time? I want to know from Ms. Dausap, the courts, it seems there's a misunderstanding regarding the numbers within the courtrooms. Maybe you could just explain. Do the magistrates and the police officers in courts and the lawyers, are they part of the 10, or who are part of the 10? Especially now the new regulations, we know it's up to 50, so maybe you can just give us an explanation on that. I'd also like to know from Honorable Shangula, the logistics plan that the minister is using, the logistics plan that you are using. it seems the vaccinations are mainly targeting urban centers. So in terms of the remote areas, what is being done to ensure that these people also are vaccinated? Thank you.
Thank you very much. Next, let's take two.
Good afternoon. My name is Shamaine Gashihere from the Namibian newspaper. Dr. Shangula, you said something about vaccines being available countrywide, but people in Irongo are saying they've been waiting for 2 weeks now and there's nothing, even I think today as well. And then perhaps I needed to understand, maybe from the Justice Minister on this one, I need to understand the logic behind having indoor and outdoor swimming pools and playgrounds open, but gyms are considered high risk in terms of the infection rate. Also, another one to what the President said about PCR tests. I think this will be for the Minister of Health. By reducing the validity of PCR test results from 7 days to 72 hours, are we not perhaps discouraging tourists from coming here, seeing that the industry has already been affected negatively by all these regulations in place? For the Minister of Education, I need to just confirm, having grade 7, 9, 10, and 11, and 12 as well on full time, does that mean we can, teachers want to know, does that mean they can teach full classes and not divide them in groups as they've been doing as of late? Yeah, and then in terms, this is also another one for Dr. Shangula. I would like to know, we have relaxed our regulations because of the rate of infections that has been dropping. However, the deaths are still high. How exactly will these regulations curb the high deaths? Or what exactly is your ministry doing to curb these high deaths? Is there something within the ministry? And then perhaps for higher education, Dr. Shangula, you only spoke about lab students and engineering students who need to be on campus for studies. But what about other students who are studying other courses? Do they now resume on online studies, or how does it work, perhaps? And then last one for Minister Dowsep. Some people want to know, bars, clubs, and casinos, do they remain closed completely, or do they sell on takeaway basis? Thank you very much.
Thank you. The short questions next one can come. You can finish.
Thank you. Thank you very much. My name is Franz Kolike, freelance. My question is really it's a question of economy. I think COVID has done a lot of damage to our economy. And my observation within our society, I feel like there is a disconnect in terms of key institutions that's supposed to help out, take this burden to the people. Comrade President, if I remember very well, around 2015, when you were President-elect, during the third amendment, and also one of the reasons when you motivated to have the office of the Prime Minister solely dedicated to the affairs of the government. And you come to State House and have a different responsibility. What I'm trying to say here, you have initiative that the State House initiate, hosted at State House. And then you have the initiative of the government within the government. So I feel there is a disconnect here in terms of coherently support each other. But I also want to talk about the question of political hostility in the country and how it affects the question of economy to help out our people out of this COVID crisis. I have observed that maybe local authorities that are not under SWAPO, for one, if I can put it that way, the President, you seem to give it kind of a goodbye. You are not involved as the political head of the country. is the political head of the state. And I think that's a bit, it's a question that should not be left in that way, just because the race of election has produced that result. I feel like the question of leadership, political leadership at the government level and at the state level.
Out of order, I want to stop you. We are talking about issues we discuss here. Call me there and ask the question.
No, I'm bringing that question within the context of the economy.
Link it, let's see.
Okay. So, but that's the sense of it, the disconnect that are in there. Because this disconnect is what really gives birth to the crisis. We need to solve the crisis at the hand of economy. How are we going to do that if people are not in harmony in terms of going forward? I feel like the Namibian House must move together in the same direction. So that is the spirit that I thought I should put my question forth.
Let me say the same. You want to finish? Oh.
Yeah, I think those, for me, the political question, I think, is an impediment. It does harm growth of the economy if it's not handled to everyone. Or if the other end is on this side, the other end is on the other side. I think it does not make a case of development. I thank you.
Well, let's start to answer. Okay, another round. Who wants to start, Minister?
Thank you. Thank you very much, Comrade President, and thank you, colleagues, for the questions. I have my colleagues there. All the questions from the first person who took the podium, I was having difficulty to get the questions. But maybe my colleagues have taken note of the questions. Alternatively, you can forward them to me via my piece so that I can read them correctly, like the colleagues have done. Now, I will start with the questions from Charmaine. When will Erongo get vaccines? We have been waiting for 2 weeks. I am not so sure what type of vaccines which is being requested. If it is Sinopharm, Erongo has received sufficient doses of Sinopharm. If it is for AstraZeneca, we have not yet received AstraZeneca with the last delivery of the consignment. We currently only have Sinopharm in abundance, and Erongo have received their vaccines, and they are carrying on with the vaccination campaign. What is the logic behind having indoor and outdoor swimming pools to resume operation, but the gyms and sports clubs are regarded as high risk and remain closed? In terms of division of labor, I will ask my colleagues over there to tackle that question. By reducing the validity of PCR test result from 7 days to 72 hours, are we not discouraging tourists from coming here, seeing that the industry is already struggling? I do not share the same views. Initially, we did have the 72 hours requirement, but then it was changed mostly due to many Namibians who were having difficulties to connect from one end to another. But as far as the tourists are concerned, they have never experienced difficulties with the 72 hours. The 7 days was mainly as a facilitation for the returning Namibians who want to come back home. There is one question, but I think it's on education. The education will tackle that. We have relaxed our regulations because the rate of new infection are dropping. However, deaths are still high. How exactly will this new regulation curb the high death rate? Or what exactly is the government doing to reduce the deaths? We need to understand the difference between the two. The measures currently in place, and as has been announced, is to prevent new infection. The question of death is another stage altogether. It means the person has already been infected. And there are quite many reasons why we are still experiencing many deaths. Number one of them, you might have learned that when we do daily announcement, we also informed how many persons died at home. The other information we will need to share with you is the fact that most of the deaths, they arrive very late at the hospital. They will spend a few hours to a few days. So very late health-seeking behavior. I also have some clinicians over there. They will also expand on the reason of death. So those are the questions I was going to attempt to respond, but my colleagues will also elaborate on that, and I will expect you to give me the questions. Thank you.
Let me answer the political questions, which I didn't want to do. Firstly, if people want to demonstrate, that is their democratic right. We fought for that. The people must express themselves freely, peacefully, demonstrate, complain. That's their right. If they violate the laws, they are law reinforcement agencies. So I don't see anything that has gone wrong, illegally or so on. So if you want to demonstrate, that's their democratic right. They want to express themselves one way or another, but unless I can be shown a letter that was written to me by Mr. Noya to beg me to appoint him, I cannot discuss that issue. First, bring the letter that is being said in a Namibian that he wrote to beg to be reappointed. What a shame. So until I'm asking that letter to come, that I have never seen, I cannot discuss that issue. If Namibians want to demonstrate because what happened in the parliament legally, constitutionally, that's their right. Let them demonstrate. As for the so-called vacuum or so on, let me tell you, and I'm a political scientist, by the way. I'm a political analyst, I'm a political scientist. I studied these things. I don't pick it up in the street. That is what is called presidentialism, that we have been practicing for many years in Africa. I have said, where everything is president in those kind of systems. Even a chicken run, president must there to inaugurate it. We are saying we are the third wave of African leaders who are coming, no, not extraordinary personalities, demigods or so on, those extraordinary personalities who freed us, and so on. We're a third wave African leaders who come through processes, systems, institutions, through elections, democratic always, somewhere through coups in the past. So that's a different situation. So if you're expecting presidentialism, or presidentialists to be everywhere in a single what you call, then you are living in the past, my friend. We are dealing with processes, systems, institutions. Why must I have a minister of health who is appointed based on his expertise, that I must go and interfere with what he's supposed to do? I allow him to do. We come here like this to answer, to be accountable, and I'm in charge. You don't come to these things always, you don't see me maybe because of that. I saw you maybe 2 times before. But it's about 30-second briefing we have here, which I have chaired. So if you talk of other political things, let's talk somewhere else. Since you saw about colors, maybe so, that's a different matter. It belongs outside, not here. But we are not dealing with old-style things, presidentialism, president everywhere. No, we are moving on. We are dealing with processes, system, institutions, and third wave leadership. Dealing with processes and system institutions. And as I said about the investment, you start with ministers first. Don't come to State House first. So you're not going to see me in business unless they come for courtesy calls here. That's the approach we have here. So anyway, vaccines, did you answer the vaccines question? Economy, who is going to answer economy? Prime Minister?
Yes, thank you, Comrade President. I hope that I got the questions right. I think there was a question first about the accountability for the donations pledged towards the fight against COVID. I hope I'm right in that. And the queries seem to have been that there is no accounting for these funds in spite of the promise to do that. I want to indicate that indeed there was accounting provided for the use of the donations that were made towards COVID. I must indicate that the donations were provided in different forms and also through different institutions of government. There were cash donations that were made towards a special account that was set up under the emergency fund that is at the office of the Prime Minister. We did give an account of how much was received and what was allocated to what and what remains in the account. But you would be aware that that report is not sufficient in terms of the accountability system of government. Funds that are pledged to the state or paid to the state and used by the state are to be reported on through an audit report that is provided by Auditor General, and that audit report is submitted to Parliament within the time frame stipulated under the State Finance Act. Specifically, the statement of accounts for government institutions are provided not later than September every year, and after that the Auditor General has a time frame within which the report is provided. So, for example, expenditures incurred in the last financial year would still be under audit by Auditor General, but as I indicated, we have provided a narrative. We indicated that at that time we had received about $51 million into that account, and much of it was committed towards food for the vulnerable groups that were affected by the recession as a result of the COVID. There were also procurement of materials and supplies like easily accessible and also to price them in such a way that the costs thereof would not impose a burden on the companies that are already affected by the COVID as a result of a recession. It would be necessary that the financial institutions are in a position to establish the solvency and the liquidity of the companies to which funding would have to be allocated, because we want to make sure that the funds that are allocated would indeed assist the economy to recover. So the company must be in a position to undertake new activities when it has received these funds. And if there are specific challenges in regard to providing the information that are required by these financial institutions, my advice would be that these be taken up with these institutions or with the political leadership in the sector, being the Ministry of Finance, or even with the Office of the Prime Minister, but we want to get the details. It's difficult for us to just generally decide that we are going to waive the requirement of submitting financial statements, because if we do that, it may generate unintended negative consequences. If Comrade President would allow, I can also say something on the funding to local authorities. I think somebody said that it seems that those local authorities that are not, where SWAPO does not have the majority on the councils, are maybe being marginalized in terms of funding, or maybe they are not getting the necessary political support from the central government, including the president. I would like to say that that is not so, because development in our country is not undertaken on ad hoc basis. We do have pre-agreed policies and plans incorporating programs of activities that are to be implemented, which are costed. And allocation of resources are based on, first and foremost, priorities as agreed to be implemented in different parts of the country, regardless of who is in the majority in a regional council or in a local authority, and also on the total resource envelope of government. So if the economy goes down, of course, the public revenue would also reduce, and the allocation of the budget to different regions and local authorities would reduce. But the size of the allocation of the budget is definitely not be based on who is controlling the regional council or the local authorities, nor are these structures acting in a policy vacuum in terms of what the priorities are. So there is no region or local authority that is an orphan on account of the fact that SWAPO is not dominating there. But I think what is important also to point out is the fact that we have always had regions and local authorities where SWAPO does not have the majority. And there was no such view that these regions or local authorities are somehow neglected or they are denied resources. So it is really difficult to understand why there seems to be that feeling now in regard only to specific regions and local authorities. So I think really that kind of perception serves only to traumatize the communities in those areas by making them to believe that they are not cared for by the government, but there is absolutely no basis for that belief. Thank you.
Yes, this briefing has been very professional, 31 times. And we had very, very structured way of discussing it based on COVID-19 reports we are giving, and people have been asking on that. If you want to bring in the political situations, make an appointment, go and call us. At SWAPO rallies, we will answer it. But here we are here to give the nation update professionally, as we have been doing now for 31 times in this place. Some didn't, of course, come here, and it's the first time. One is only for second time here. That's maybe where the problem is. So we cannot be diverted. I think we have reported to the nation as to where we are with a serious problem. And I think, since we are going to talk politics, I think I will end it here. Those people who have been, yes? 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 You can take the floor. I thought we were finished with asking questions on what we have presented.
Good afternoon, Your Excellency. I'm Edward Mumbu from Nampa. I have a few questions. Perhaps the first question is on, if we look at the, like my colleagues earlier said, that our economy has really been ravaged by this pandemic, and reports show that at least 12,000 people have lost their jobs. And last year, the government gave around 750 to around 800,000 Namibians. Perhaps are we looking at also giving these cash injections to these people that have lost employment? The second question is on, is it not perhaps also time for government to take the issue of BIG, the basic income grant, seriously, especially during this time of the pandemic? And then the other question is on the town councils. We are receiving complaints that tabs are being closed because families owe local authorities, but there was an instruction by government that no households should have their water cut. Yeah, I just wanted to bring that to the President's attention. Maybe Dr. Shangula, I just want to find out, what is the rationale behind saying you have banned contact sports, let's say football, where you have under 40 footballers, including their technical teams, yet you allow 50 people who may be drinking alcohol or whatever it is that they are doing, uncontrolled, unvaccinated, to just be there for 2 hours. Maybe if you can balance us, you ban contact sports, you allow 50 people to gather and do whatever it is that they are doing. Where is the rationale there? And Mr. President, I see you touched on the political questions, especially the appointment of the ACC director, which comes in the midst of the pandemic. Yeah, so I will also just want to say I believe that the President, perhaps you were informed by your foresight and wisdom in your nomination, perhaps just to take the nation into confidence. What are some of the things that you looked at when you decided to nominate Mr. Noah, who's believed to be a colossal failure in the position? The second one on Mr. Noah is, of course, we trust that the President operates from a place of goodwill and in the best interest of the country. But we might not have a president like you forever. So in the event that there is a president who still has the discretion to nominate the ACC director, is there no room for abuse when there are no checks and balances? The president can actually nominate anyone without being questioned. Yeah, so those were my few questions, Your Excellency. Thank you.
Anybody wants to answer? Relevant. Oh, okay.
Another one. I'm Charlotte Nambaje from the Namibian newspaper, and I have some few questions posted to the Namibian by some police officers for the health minister. Honorable Shangula, some police officers would like to know why police officers, frontline workers, are not included in the COVID-19 daily updates, but they always announce the number of teachers, learners, and students. Second question is, police officers are getting infected daily as frontline workers, and there are no wellness programs in the force. We have serious shortage of manpower due to members being isolated or quarantined. Sometimes the whole shift can be sent for isolation. What is the government or the relevant ministry going to do to address this they ask. Thank you. Okay, I'll do so. Honorable.
Is yours? Who's taking
Thank you, Comrade President, and thank you for the questions. I caught some of them, and I ask you to forward those questions so that they can get proper attention. Now, Mr. Mumbu, I think you asked a question. Contact sport versus the school. Contact, okay, you talked about soccer, contact sport versus what? Which one?
Contact sports versus public gatherings, which are currently limited to 50 people.
Oh, public gathering.
Yeah, public, any types of gatherings.
Okay.
Yeah. Perhaps also on that note, if the president can also touch on the issue of public officials, senior government officials, violating these COVID regulations, especially at state funerals. Thank you.
On public officers violating, only case I know is a SWAPO. Now we are being diverted. This is the problem. We got people who can divert us from what we normally do here, since they are new maybe for the first time. When SWAPO violated, so-called during the birthday, where you counted everybody was there, we were punished. We paid. So people are counting people who are essential workers. They just count everybody, including journalists were counted that time. When you say we have more than that, journalists were counted too. But we paid. So as for government, if you are counting at the state funeral, the army, those who are there to now perform their essential duties, those who are security officers who are there to perform their security essential duties, there will be more. But state is a state. There seems to be wrong understanding of equality in this country. If we are all equal, like it was in the in the Greek city-states, all citizens used to participate that time. But as populations became bigger, they said, we cannot all do that. Let's elect representatives that will go and represent us. We give them a mandate for 5 years or so, watch them. If not, we remove them. That's what we have here. Now, this equality thing has been misunderstood. If you have a president who has a security, they follow him. Oh, hey, are you going to count those people who are doing their essential duty? So maybe that's why we didn't explain properly. Or family. There are 10 people who are coming to mourn, but family members in the house, are they going to count them? Maybe we didn't clarify that issue too. So really, I saw it in the late Kavira's case. Here we are at the, what is that place? What is it? Kagarara. Now, we had officials inside, the government officials, governors, and so on, ministers inside. There are 10, a few family members. The children of the person they were all outside, crying there outside, their father. So I told them to come in. I said, don't count us, don't count me. I'm not a close family. I came to bury an official, my friend, but those are children. Common sense I use. Let them come in. Real children were outside. That's not using common sense if we interpret the law that way. So we must have common sense too. Right now we are more than 10, if we talk about 10 people. But if I'm going to count all of us, we are violating the rules. But you are doing your job as journalists, others are here as officials. So that's about misunderstanding about the issue of violation. We had a serious case of culture. Now we deal with the question of that we call law, strict reconstructionist of law, strict reconstruction of laws. Then in some way of teleological approach, circumstance of the case. Now here we had a case of a chief Umbara with special culture, with rituals that has been done. Now although the law, I say maybe it must be 10, and people come with the culture and rituals that has to be honored, that culture says, the tribe, the culture says, it must be done. Now, as a law implementer, I'm looking at the law as it is written and circumstances of the case. So we said we will withdraw our legal practice. We're not going to be part of it. You are saying you have your culture, tradition, it is done that way. Now you look at the circumstance. If you were to stop those people that time there, what could have happened? Circumstance. Maybe riot, or some people could have been killed. We said, government will withdraw, official funeral, but we are going to withdraw. Our culture of government is going to withdraw. You will take extra days, that's your business. Because we look at the circumstance of the situation. Therefore, there's peace today. So we don't just implement the law blindly without looking at the circumstance, conditions that are there. They differ. And there are exceptions sometimes to a rule, everywhere, logically. So that's how we do things. Big is a thing, I was part of it. A second meeting I attended. At that second meeting, I also asked the question of presentation. You are saying, according to big principle, each person must get, if it's $100, they must all get $100. There are billionaires, they must get $100. So I was asking that question, why should it be everybody getting equal amount? Why don't we look at needs? Why should I get same as a person in Karutura in the street? Does it make sense? That's my problem with big. And I even talked to Brazilians who started the thing. They said there's also a problem there. You must, your common sense. So the problem we have is we don't have money to start with. Now to give everybody, all the ministers who are sitting here, the business people, billionaires here, they must all get $300. Universal, what is it? Big. Big is universal. Basic income grant, but it's universal. Each person must get equal. I have a problem with that. Even the communist theory that we've been using goes with each according to his ability and each according to his needs. So if those who have ability provide them facilities, the environment in which they can use their abilities to make their money, so that you can concentrate on the needy. That's what even basic principle Marxism says. Now, to say everybody must get equal, it's not even communism. I don't know where it comes from. Because communists are saying each according to his needs and each according to his ability. So people of ability must be provided environment where they can use their money. But even government must concentrate more on poor people and provide environment, conducive environment for those who have ability, who have money already. But we are told we must give everybody the same amount. That's where I have a problem. And we said there's a modified big. that we said modified. It must be modified. I talked to the Brazilians too. They also said not everybody gets it in Brazil. And at the moment of the crisis we have, economic crisis we have, to say universal, let's use our brains a little bit. That's where the problem is. So we don't have, economy is in trouble, you know that. So we are still studying, talking with people to try to convince them about the logic of each person getting same thing, rich or poor. But tax is going to sort it out. That's where the problem is. But even what we have done already, the food bank went a long way. It went a long way. We're trying to convert the food bank into a big, modified big, and expand it. That's about the big and so on. Is there anything else? Yes, ma'am.
Thank you very much, Your Excellency. There were a number of questions raised towards the Ministry of Justice. Some of it, I think, will be addressed by the medical practitioners at the back, particularly around swimming pools opening and so on. But I wanted to tackle just two issues. The one is there are a number of gatherings in the regulations, and that will remain so, that are exempted from the prohibition. Among those gatherings is courts and tribunals. That means the only requirement that is expected at the courts, and this is something that has been done by the Office of the Judiciary, who are actually responsible for the administration and management of the court system, is that they have issued a number of directives throughout this pandemic that sets out what are the allowable people, for example, in the gallery, but of course those that are working there, like the prosecutors, the presiding officer, and the legal practitioners for defense, they would normally be allowed to be part of those that are working there. But also during those directives makes provision for appropriate social distancing and so forth. Courts and tribunals are exempted from the 50, or in this instance, the 10-person requirement, as is the case with state institutions, as it is the case, for example, with people who live in the same household, and those that are gathered at the workplace. So even media practitioners know that at their workplace, if there are more than 10, they continue to operate on that basis. The only other thing I want to indicate around courts is that we have, for health reasons, we have suspended the conveying of prison inmates to, for example, court activities, because it is not safe at the moment. There's also no interaction between members of the public and those that are in prison. It's the same directives that have been issued also for hospitals. So those directives, unless they're changed by the institutions responsible, remain in force. I also just want to indicate, in respect of bars and nightclubs and bedding houses, under the current regulations, and this regulation will continue, are prohibited for purposes of that activity. So we don't expect that bars and nightclubs would be opened. If you want to participate or benefit from business activities that relate to the selling of alcohol, for instance, then that should be part of what you would have done ordinarily. So I don't want to indicate anything about what should happen, but for the moment, that is the position of the law, that those ones are prohibited. I also just want to clarify, Your Excellency, that transport does the requirements or the prohibition on the half load for transport does not include private cars. Thank you.
Yes?
you for giving me this opportunity. I will feel actually that I'm doing a disservice to the members of the media if we don't respond on this here. So I just wanted to touch on some medical issues which were actually asked. So just allow me a few minutes. I think the first one is actually, it was asked by Charmaine, if I remember the name correct. It was about deaths, the number of deaths and the number compared to the infections. Okay.
Introduce yourself.
I'm Dr. Kashita. I'm a specialist physician working for the Ministry of Health and Social Services. Sorry. Yeah, so I just wanted to react on those medical-related questions which were actually posed, which my Minister Shangula have actually referred back to us as experts being here. So there was a question of actually that what we have actually, from our side, what we have actually been observing is obviously over the last 2 weeks, we have definitely seen the number of deaths, the number of infections being significantly reduced. Remember, somewhere there during our data or observation at the time when we were in the peak of the third wave, this was round about, to be accurate, from the 21st to the 27th of July, we noted that those numbers, the numbers of infections were close to 2,000. And then obviously also during the same time, the numbers of deaths were around about 600. And we have now, up to date now, when we are coming down now, we are realizing that those numbers have significantly come down. The infection rate have actually come down by a daily number of around about 320, if I can be round about there. But anything between 250 and 320. And the deaths have also significantly reduced from the previous numbers which we have also been talking about. We are talking now about around about 50 deaths per day over a 24 hours period. And we also, at the last meeting when we were here, we did mention that there was clear reasons why the number of infections have actually gone high. And we were also very clear reasons why the death rate have also gone high. At that time, we were actually suspecting that the Delta variant, which was responsible for the tragic loss of lives and the suffering in India, we've actually seen that at that time we have actually seen those high numbers and those high deaths. And we clearly attributed that to the Delta. And then obviously with us, it was exactly the same thing. We have now confirmed that this Delta variant is actually here. So clearly the numbers of infections have definitely been high. But the good thing with us is actually that we have, through the regulations and the public measures which have obviously been brought in. We went through lockdowns, we went through curfews during the last period, and we have also, the public have also been urged to adhere to the general control measures. I don't need to repeat them: the sanitation, the social distancing, and all that. And clearly, those measures have definitely brought us where we are now. That the numbers of infections have actually gone down, that the numbers of deaths have also significantly gone down. But still, if you compare the infection rate as compared to the death rate, they don't tally together. I understand why you asked that question. We're still seeing the numbers which are there, and the one point which I just want to clarify is actually that you must realize that it takes a while for individuals to come to the hospital. They go through, many of them, because this is a flu-like type of, they start off with a flu-like type of illness. Many individuals will actually be observing them at home. And quite often, some people will also be using their own home remedies, and some people might also be using some unproven medications as well, where they observe them. This is the observation what we have actually been having, where they observe themselves at home for a period of around about 10 to 14 days, only to realize that these symptoms are actually getting worse. And then at the last minute, they actually end up coming to the hospital. And then obviously during the hospital, by the time when we actually see them, they are in a much more worse condition than what we are. And at times, this is sometimes the measures, the clinical measures which we will actually be applying to them might already not being very effective, or they have been so worse that they had to go to critical units to take care of them. And clearly, these people who are coming in here are basically more sicker than what they are because of the delay of coming to hospitals and making that. And then you must also understand that there is also a lag time between the infection and the deaths as well. It takes a while for people to get better, and what we have actually noticed with the Delta variant particularly is actually that this variant was much more aggressive. If we compare with the Alpha and the Beta, which we had in the previous times, people will actually be coming in the hospital, and they will spend an average of around about 7 days in the hospital. Even if they were severe, they will actually be responding to treatment. But what we have actually now noticed with these severe cases, they come in the hospital, they remain for longer than 2 weeks in the hospital, and then very often, or some of them will actually advancing to critical states where they may need machinery equipment to keep them alive. And at times, these outcomes are also not very, very, very good. And that's the reason why we have actually got those high numbers. So although we have brought down the numbers of infections, there is still a bit of time which is actually lacking, either to actually to treat these people successfully and get them out of the hospital alive, or the unfortunate event of them actually passing on. And that's why we're still seeing this disappropriate relationship between the infections and the death. If I can just relay that back. The issue with gyms being closed, the contact sports being banned, and obviously, and then versus the 50 people allowed together at gatherings. I mean, you must take a few things under consideration. The Delta is still spreading everywhere in the world. It's easily transmitted. It gets from one person to another one very quickly. And although we have actually seen the numbers of infections going down, our numbers have not gone to the previous numbers which we were actually used to. You remember that at the beginning we had numbers of, when we were talking about, we actually had numbers of around about 40, 50 during the second week, the second wave. Our numbers peaked around about, it will be around about 300, but still when we had the second wave under control, those numbers went significantly down. They went down to lesser than 30. We are still not, our daily numbers are still in the hundreds, in the 200s, so we are not yet there to say that we can easily relax everything and just say that contact sport should actually be allowed. And we also know that this virus is in the community. It has not gone away. It's still in the community. There's still community transmission, because we will still be finding people who will be coming to us as healthcare providers, not knowing exactly where did they catch this infection. And clearly, you need to be much more stricter to look at that. So, and that's one of the reasons when we're looking at high-risk activities, such as, for instance, such as the contact sports. You spoke about the, for instance, soccer matches, boxing. You spoke about the swimming pools. What do these people go? They all go in the dressing rooms. And in those dressing rooms, it's so confined. The areas, that environment is actually a relatively confined environment. You don't know who was there, who used those facilities, who used the shower, who used the bathing rooms, and usually it happens very quick. It's not like you have got people who are coming afterwards and cleaning, fumigating, and making sure that there is nothing which is actually left. And we all know that this infection is actually being carried by droplets which have actually been left behind by someone who have actually used the same type of room. So the risk will still be remaining high with individuals who have actually been, in that type of contact activities. We know that most of the sports people don't get sick, but they don't develop symptomatic disease to the extent that they will have to be bedridden or stay at home or not doing anything. But they will still be they will still be carriers of this infection, and wherever they are going, they might actually leave droplets. You have actually noticed with the Olympics now, there are many sports people who are actually withdrawn from participating in this year, and the main reason is actually because of that. So this is basically some of the reasons why we're looking at that. Clearly the allowance of more than 50 people, 50 people at gatherings also come with its own restrictions. If I listened to the Honorable Minister of Justice, she did mention that the 50 people it's reduced to the 50 people, but it doesn't mean that it's carte blanche, that everyone goes there and do whatever it is. The regulations or the measures, the infection control measures are still in place. They still need to social distance. They still need to sanitize. They still need to do whatever they need to do. I think this was mainly brought through human. It's more a human consideration of actually saying that we have actually been suffering for a long time. If you go to many people, they will actually tell you that these lockdowns and all these curfews and these restrictions have really hampered our life. In particular, with funerals as well, people were looking and crying for a much more humane way of parting with their relatives. And this is the main reason why these regulations were actually brought on to, let's say, allowing 50 people. There were issues with the PCR test restrictions which might actually hamper the tourists, but I would like Dr. Sikuvi to come and maybe respond on that. Thank you.
His Excellency, the President of Namibia, all protocols observed. I'll be very brief. Allow me, I will do this service if I don't convey this message from the healthcare workers. On behalf of the Namibian healthcare workers, we say thank you to the public for adhering to the COVID-19 regulations. The week of 21 to 27, during our peak, we had patients coming in. For us as healthcare workers, we talk about patients. This time around, we were talking about friends, families, brothers, sisters, colleagues, no longer patients. It was all of us touched. Before I continue, maybe let me introduce myself. I'm Dr. Sikuvi. First name is Kaweto. I'm an emergency medicine specialist, and I'm the lead for case management, COVID-19 National Task Force. So to touch on the 72 hours. So as my Honorable Minister, Dr. Shangula said, we haven't really seen from the tourists themselves as a real main issue. Part of the reasons, what we have seen with the COVID-19, the Delta variant itself that has caused havoc all over the world, is that because of its transmissibility, you can easily get it, and then 7 days for people to come to Namibia. Most of the time, we don't have really a direct flight. By the time you reach Namibia, you have traveled for 4 or 5 days already. So, and you have traveled between 3 or 4 countries. And during that period, you may have picked up a variant of COVID-19, and coming into the country without a recent test may be a problem that may risk the public. We are working so hard. Currently, as I said, the public have really done their best, especially those who have really tried to make sure that we stop this further spread. We want to keep it that way, and we want to make sure that we are getting the numbers that we want to get, and case fatality rate, we want to bring it below 2, and also the infectivity ratio below the expectable number. Currently, we are at 20, which is still high, and we want it to be below 5%, according to the WHO. So on that note, I would like also to say that the issue of the gyms, just a little bit touching on the gyms, we know that the gyms, really, it's difficult to adhere to the preventative measures. You cannot exercise with your mask on, and it's a closed space, as well as the clubs. So in these areas, when you exercise, you hyperventilate. Hyperventilation without a mask is spreading if you are infected. So which means that all the equipment you are using will be contaminated. And also, if you are in the club, of course, the club it's a very close, almost intimate kind of entertainment where we cannot really control the further spread of this disease. As I said, I'll be brief. His Excellency, thank you.
Well, doctors should have been called earlier, nearly diverted from what we're here for. 2 hours are already over. We are supposed to meet only for 2 hours. What? You just came now?
One question.
Okay.
Sorry. I would like to, I'm Liesel Nell from Newsflash magazine. I would like to ask the medical professions and the government, are we fighting the COVID Delta, or the COVID virus in the right way? I mean, you know, from common sense, for me, if I look at it from a layman's perspective, a virus affects your body and you have to produce antibodies to fight against this virus. This virus has now been spread all over the world, but are we not incubating the virus, you know, by keeping people restrained into their environments where they normally move around on a daily basis and, you know, keeping the infection in certain areas or boxing the infections in certain areas? I'm just asking, are people, you know, in my opinion, should we not be out and about, you know, doing cardiovascular exercise? I know we might spread the virus a little bit, but are we not keeping it in and we are not actually allowing this virus, you know, to move out of the atmosphere? Are we holding it down somehow? I don't know if you feel the same way that I am, but I mean, it's just getting worse and worse. So many people have now lost their lives because, you know, we're fighting this virus with these, you know, sort of it's not chicken, it's really very strong methods, but I mean, from a physiques perspective of a human. I mean, humans were designed, you know, so that their bodies can fight these viruses, and this was a flu virus that started. It's now turned into, okay, it was an anti-respiratory, you know, it affects the anti-respiratory areas in your bodies. It's now a Delta variant, you know, it's just getting stronger and stronger. But, you know, I think we should go back to, you know, to grassroots where, you know, people need to exercise. They need to exercise their hearts, their livers, their lungs. They need to get out there and move around. I don't know if it's helping that we're keeping them in corners in their homes and making them aggressive, or we're keeping them in corners, we're keeping the viruses. I think I'm just asking, are we fighting this virus in the right way? And, you know, maybe we should look at different ways to deal with the virus. Thank you, Your Excellency.
Well, thank you. That's for doctors.
Thank you for a very good question on that, or the good response on that. You see, we don't really want to be misunderstood. We are not saying stay away from sport. Please don't misunderstand the issues. The sport, in fact, generally, there are even some studies which have actually shown that sport is actually the right thing because it actually increases your capacity, your lung volume, and since this is actually a respiratory virus, most of the time, your lungs will actually be affected. So their studies have also shown that those who are exercising regularly actually seems to be overcoming all the effects of COVID in a much more faster way compared to anyone else. The issue of clarification is really about the exposure. You know, there is actually no one who's immune to becoming infected, unless you have actually prepared your body in different ways. At the moment, the current evidence, which is really showing to be very effective in terms of actually avoiding you from getting infected or spreading the infection, is actually only through vaccinations. That's why people are actually looking at that. Yes, we have seen people who have actually been vaccinated who actually end up getting the infection, but the difference is just that even if they get the infections, those who have been vaccinated, they seem not to get so seriously ill, severely ill, and ending up in hospital. But the most important aspect of that is actually that they don't spread the infection. The virus is actually controlled in just one body. We're talking about the community transmission of this infection. Many people are coming in the hospital and they don't know where did they pick up this infection. And our consequences, and generally if we look at that, it's obviously people who have additional diseases, but it's also elderly people. And these are the biggest these are the biggest part of the population which actually ends up in the hospital. And the unfortunate thing is actually that, yes, younger, healthier people don't seem to be getting so sick that they will have to be ending up in hospital. But with the Delta virus, which we have actually which is actually easily transmissible, we have actually noted that those infections are actually being harbored by younger, healthy people who tend to be getting those infections outside, including also through contact, through sports activity, that wherever they've been, they don't get sick, they don't get anything, but they go back home and they infect the other part of the population who are much more vulnerable. And that is the main reason why we really thought this should actually be controlled. But when they are doing their sports activity without or in limited groups where they don't need to have these big control groups as what you will be seeing with soccer or what you will even be seeing with that should not be a big problem. But the main problem is actually also to protect the others. And that's the reason why we rather had to control that. And the other issue was also that, yes, this is a virus, just like a flu. Every year we get a flu. And when we get flu, we don't get, some individuals get vaccinated, some individuals don't get vaccinated. They do acquire their own immunity. It is a dangerous notion with the coronavirus, unfortunately. You know, I would like to invite you to take you to the hospitals to see individuals who are actually lying in the hospital, who didn't have any comorbidities, including a higher age, diabetes or whatever it is, young people as well, who are actually there, who have actually picked this virus up and not knowing what this virus will actually do, they actually ended up in very serious critical conditions, and they actually ended up losing their lives. And that is a problem with corona. I mean, with this COVID infection, with this coronavirus, it's not like a virus like the others. It is not a man-made virus, or it's not a virus which we as Namibians have actually invited it because other people in the world are also having it. It's a virus which has basically come from somewhere and which has actually gone through the whole world in a pandemic way. And unfortunately, as much as what we want to do It is there, and we need to deal with that, and we also need to follow the advice and the recommendations of those who actually had it before us. And the only way how to do that is actually through the control measures, which we have actually been saying. And yes, the control measures have also helped a lot. In fact, because there was also a question in terms of what have these lockdowns have actually brought on. I mean, we had a higher number of people being infected. We know about the deaths, and these numbers are actually coming down now. So there is no way how you can actually say that, no, we're just locking down, we're just curfewing everyone. Definitively, these things have actually done something. And the main advantage, what the government is actually trying to do is obviously through the vaccinations, and these have actually proven themselves very effective in other areas as well, even in terms of the individual being infected. If he was vaccinated, his chances of actually taking and spreading this virus is basically becoming very, very limited. And those are just my response to that. Thank you.
Well, thank you very much. We are already more than 2 hours. We are supposed to be more than 2 hours at the place. So I'd like to thank you, the doctors who came to help us as experts. I think you should have been there from earlier on. Would have been different to focus the discussion on what we came for, what we came here for. I'd like to thank all of you. Once more, I would like to appeal first to thank frontline workers, doctors, those who are sacrificing their own lives to save us, and then to also express condolences to Namibians who have lost their loved ones. On that note, thank you very much. Until next time.